Hello and welcome students. I, Dr. Adil Patel, welcomes you for the discussion of the topic apparent volume of drug distribution, plasma and tissue protein binding of drugs and factors affecting protein drug binding. So let us see what is apparent volume of drug distribution. So the theoretical volume that the total amount of administered drug would have to occupy to provide the same concentration as it currently is in blood plasma. So basically the amount of drug needed to replace the existing concentration of drug in the body is called the apparent volume of drug distribution. I repeat, the amount of drug needed to replace the existing drug in systemic circulation is called apparent volume of drug distribution. The apparent volume of distribution describes the relationship between concentration and the amount of drug in the body. So here you can see the amount of drug is equal to the total volume of body or total volume of any particular compartment into the initial concentration of drug, that is the dose of the drug. Now how can we calculate the volume of distribution, which is described by using capital L? So expressed as liter of body water in a 70 kg man. So this is the ideal value. It may vary subject to subject, but for the ease of calculation we are considering a 70 kg body weight person. So in that person the volume of distribution is equal to Q by C. What is Q? So Q is the amount of drug in the body. Capital C is the unbound plasma drug concentration, and that can be expressed in the terms of gram per liter. Now calculate the volume of distribution when 1 gram is administered intravenously and the plasma drug level is 0.024 gram per liter. So in this particular situation, the volume of distribution would be 42 liter, that is the total body water. So this is how you can calculate the volume of distribution. You need the dose of the drug and you need that amount of drug present inside the body. Now let us see what is protein binding of drugs. So the phenomena of complex formation of drug with protein is called as protein binding of drug. Basically, it's a complex formation between the protein and the drug inside the body. As a protein bound drug is neither metabolized nor excreted, hence it is pharmacologically inactive due to its pharmacokinetic and pharmacodynamic inertness. That means drug which has formed complex with protein will not exert any pharmacological effect, but it will remain in circulation for the longer duration of time because the excretion and the metabolism of such complexes are very difficult. So a simple process of protein binding, you can see that body has various proteins, and when drugs comes in contact with such proteins, there is a complex formation between the protein and drug. Now overall the protein binding is divided into two separate categories. One is intracellular binding and second one is extracellular binding. So as the name suggests, the protein drug binding takes place within the cell or the protein drug binding takes place outside the cell. The binding of drugs to proteins is generally of a reversible and irreversible process. So in some instances you will see that the complex formation process is a reversible process, and again the complex can dismantle easily. In some instances you may notice that the complex formation is a irreversible process, and once the drug protein complex has formed, it's very difficult to reverse them. Now in case of reversible drug protein complex formation, it involves weak chemical bond formation such as hydrogen bond, hydrophobic bonds, ionic bonds, and van der Waals forces. In case of irreversible drug binding to the protein, though this is a very rare process, arises as a result of covalent binding and is often a reason for the carcinogenicity of tissue toxicity of the drug. So some drugs may produce carcinogenic effect and toxic effect. So whenever you encounter any such situation where the administration of drug is producing carcinogenic or tissue toxicity, then it might be because of irreversible complex formation with the protein. Now let us see binding of drugs to various blood components. So first one is the plasma protein drug binding. So the binding of drugs to plasma protein is reversible. The extent or order of binding of drugs to plasma protein is maximum amount of drug binds to albumin, then alpha-1 acid glycoprotein, then the lipoproteins, and the minimum amount of drug will bind with globulins. The binding of drug to human serum albumin. So it is the most abundant plasma protein, which comprises 59% of the total plasma protein, and it has a molecular weight of 65,000 Dalton with a large drug binding capacity. So the human serum albumin has a very large drug binding capacity. Endogenous compounds and large variety of all types of drugs can easily bind with the human serum albumin. Now there are four different sites on human serum albumin for drug binding. The site 1 is for warfarin and azapropazone binding site. Site 2 is called the diazepam binding site. Site 3 is called digitoxin binding site, and site 4 is called tamoxifen binding site. The next is binding of drug to lipoproteins. So lipoproteins are amphiphilic in nature. It contains combination of lipid and apoproteins. The molecular weight of lipoproteins in the range of 2 lakh to 34 lakhs depends on their chemical composition. Lipoproteins are classified on the basis of their density. So we have various classes of lipoproteins like chylomicrons, then very low density lipoprotein, low density lipoprotein, and high density lipoprotein. Next is binding of drug to globulins. So it mainly binds to endogenous substances. Alpha 1 globulin, that is also known as transcortin, is binding with corticosteroid, and it has got binding site for specific corticosteroids. Alpha 2 globulin, which is also known as ceruloplasmin, and it binds with vitamin A, D, E, K, and cupric ions. Next, we have binding of drug to blood cells. So in blood, 40% of blood cells, of which major component is RBC, that is red blood cell, which comprises 95%. The RBC is 500 times in diameter as the albumin. The rate and extent of entry into RBC is more for lipophilic drug. So the RBCs are favoring the entry of lipophilic drugs, and thus the significant RBC drug binding is possible just because RBC is showing greater affinity for the lipophilic drugs. The next topic is binding of drugs to extravascular tissues. Here, the tissue drug binding is much more significant because the body tissue comprises 40% of the body weight, which is 100 times that of human serum albumin. A tissue can act as the storage site for drug. The factors that influence localization of drug in tissue are lipophilicity and structural features of the drug, perfusion rate, and the pH difference. So in depot formation or a sustained release drug delivery system, we are using this concept of drugs binding to extravascular tissue so that drug will remain for the longer duration of time in the body. It will form a depot, and from this particular depot slowly the drug may release into systemic circulation. Now the order of binding of drug to extravascular tissue is the maximum amount of drug is bind or stored in liver, then kidney, then lung, and the smallest amount of drug is being bind to various muscles. Now several examples of extracellular tissue drug binding are liver, lung, kidneys, skin, eyes, hair, etc. It also seen in hair, bone, fat, and nucleic acid also. Now, how can we estimate the protein drug binding, or how can we find the extent of protein drug binding? So there are two different methods, indirect technique and the direct technique of protein drug estimation. In case of indirect technique, we have equilibrium dialysis, dynamic dialysis, ultrafiltration, ultracentrifugation, and gel filtration. In case of direct technique, we have UV spectroscopy, fluorometry, and high performance liquid chromatography. Coming to the factors affecting protein drug binding. So factors are divided into various categories. So let us start with the drug related factors. So the physicochemical characteristics of drug plays very important role in protein drug binding. The concentration of drug in the body is also affecting the extent of protein drug binding, and the affinity of a drug for a particular binding component, in this case protein, is also equally important. The next set of factors are protein tissue related factors. So the physicochemical characteristics of protein or the binding agent, concentration of protein or the binding component, and the number of binding sites on the binding agent. Next set of factors affecting drug protein bindings are related to the drug interactions. So the competition between different drugs for the same binding site, which is known as the displacement interactions. The competition between the drug and normal body constituents, and allosteric changes in protein molecule. Next set of factors are the patient related factors, in which the predominant factors are age, inter-subject variation, and the disease state. Now, what is the significance of protein tissue binding of drug? So it affects the drug absorption to the greater extent. The systemic solubility of drugs is affected by the protein binding, distribution, the tissue binding, apparent volume of distribution, and the drug storage are also affected by the protein drug binding. The protein drug binding also affects the elimination of drug from the body, the displacement interaction and toxicity, and the diagnosis of certain disease are also affected by the protein drug binding. So dear students, that was all about today's lecture. Please go through this lecture and let me know if you have any query or question. Thank you very much for watching this video. Stay safe and have a good day.